Great to have you here. I'm Rob Hakala with the morning team, and it's time now for our South Shore Chamber of Commerce segment. We do it every Tuesday at this time. Tim Cahill is the president and CEO, South Shore Chamber of Commerce. Get involved, southshorechamber.org. And let's say good morning to Tim first, and then we'll get to a special guest. Tim, good morning.
Good morning, Rob. How are you?
Doing wonderful. How are you today?
Very warm in this toasty studio. Very thankful for that the heat's working.
Yeah.
It's a cold one, but it's wonderful. It's a beautiful time of year. Love it.
It certainly is. Yeah, the holiday season is here, and we've got this week some special guests. We've got two special guests in studio with us, Tim, today, right? We're very excited.
Yes. Old Colony Hospice, Jennifer Cooperman and Betsy Nazar are here. They're new members of our chamber, joined recently. They have a nice billboard up on Route 3 that I see all the time when I'm driving back from Marshfield back to Rockland. So, and they're here to talk about hospice, Old Colony, the region, and what they do, which is difficult in normal times, but even more challenging during the holidays. And that's one of the reasons why we're here. And we've got great health care on the South Shore, and these two women are part of that, and Old Colony is part of that as well.
Well, it's wonderful to have both of you here, Jennifer Cooperman and Betsy Nazar. And Jennifer and Betsy, I know you wanted to first tell us a little bit about yourself and do kind of an introduction, right?
So my name is Betsy Nazar. I'm a nurse case manager at Old Colony Hospice. Been at Old Colony for 6 years. Been a nurse for 32 years.
Wow. It's amazing. Jennifer?
Yep, thank you for having us. Jennifer Cooperman. I'm a clinical social worker. I've been with Old Colony Hospice for 8.5 years, and I've been a social worker for 26 years now.
Wow, amazing. So again, lots of experience you can tell with both of these women in here today, and they're going to talk more about what they do and also to try to answer some questions, maybe some misconceptions as well. And I thought maybe we could talk about what is hospice, right? To talk a little bit about that. Betsy wanted to focus on that?
Sure. Hospice focuses on managing the physical symptoms and the psychosocial needs of patients with life-limiting advanced disease, illnesses. Our care is really person-centered and individualized. We support patients and their families through their end-of-life journey.
Oh, wow. Okay. And Jennifer, I know you wanted to mention about some common misconceptions about hospice. What are some things that maybe you get asked or people think about?
Absolutely. I'm glad to do that because I think people sometimes are afraid to seek hospice when it could be really helpful to them. So we want to explain. I think one of the greatest misconceptions is that hospice is only for people who are in their final days of life, people who are homebound or bedbound. But in reality, hospice is really for anybody who has made a decision that they want to focus on their comfort, on their quality of life, and they're not seeking rehabilitative care anymore. Often that's at the advice of their physicians. And so we have people who are on hospice. They can be on for over a year, sometimes even a couple of years.
Yeah.
People may hear something about a 6-month prognosis, but that's really more just a guide so that the physician can determine who's eligible. We have patients on hospice who go on vacation with their families. So we just want to make sure people understand that it's for various stages. Another important thing that I want to, is that hospice does not hasten death. We're not there to do that. We're there to follow the body's natural progression, make things go as comfortably and as smoothly as possible. Another misconception is that hospice is a place, but actually we go to wherever the patient is. And so we see people, whether they're in a private home, whether they're in an assisted living, whether in a skilled nursing facility, as long as we can put the plan of care into place, we will go to where people are. We do have a hospice house, Old Colony Hospice in Braintree, but people certainly don't need to live there. It's just a service that we offer as well.
Okay, so there are a lot of probably myths and misconceptions, and I think that does come to mind probably when we hear the word hospice. That I think many people would think that is I guess that is only a short time, where in many cases it's, again, we know that everyone is different and no one fits one pattern. And so the case that I always think about is the former President Carter. I still think about when I heard he was going into hospice. I think that was kind of like a eye-opener for a lot of people. And he was there for years.
Yes.
Years. Yeah. And then I said, oh my, you're right. Yeah. And so thank you for explaining that. Now, if people do have questions, Jennifer Cooperman or Betsy Nazar, because I imagine, these are difficult topics. People might want to, it'd be great to have somebody to reach out to, how does this work? What do I do? Where do I go? How do I have these conversations with my own family members, right?
So I'll start with the piece about how do you have that conversation, because I think it's important, and this is, as a social worker, this is something we often facilitate with people. It's a conversation for families to have before they need it. I think it's very important early on to just start talking about, what would you want if you have this type of diagnosis, or what do you want the later stages of your life, or if you have a life-limiting illness. So starting that conversation before you even need hospice is really important. People can reach out to Old Colony Hospice just to get some guidance as to what the service is. You can meet with a hospice admissions nurse just to get some guidance. It doesn't mean you're obligated to sign on. So people can reach out to us. I mean, our main number, I can provide that if that's helpful now, is 781-341-4145. They can go to our website as well and just reach out to us, and we can provide information, determine if it's the right time for people to seek hospice.
And there is a great team. Obviously, we're talking with Jennifer Cooperman today and Betsy Nazar, and there's many people involved at Old Colony Hospice, and the headquarters is in West Bridgewater?
Yes, we're located in West Bridgewater. We serve about 60 towns in Bristol, Norfolk, and Plymouth County. And our team includes various members, nurses, social workers, home health aides, spiritual care, physician, and nurse practitioners.
Well, it's so important to have both of you in here today to explain this. What are some other things? Is there anything else that you wanted to make sure that people listening this morning, they're just trying to get to work or start their day, and they might have additional questions? What are some things you'd like to speak to people about this morning, Betsy or Jennifer?
I have one I'd like to, which is directed to people, to healthcare workers and people who might be interested in volunteering, so sort of another aspect of it. I think there's a misconception that working in hospice is very depressing and that people who work or volunteer for hospice are going to be miserable in their work, and it's really quite the opposite. And I think it's important for families and patients to know that the people who care for them feel this way. So the work we do in hospice is very rewarding. We really get to know our patients and families very well. We're literally sitting at their kitchen tables with them, sometimes sitting at the bedside, often sitting at the bedside with them. And so it's a much deeper connection to the people we care for. It's not just the person in room 3. And that means that people who work and volunteer for hospice tend to be, clearly we do see difficult things and are with people at very sad times of their life, but we feel very rewarded by the work that we do. It's meaningful. We have people who've worked for our agency for a very long time. And so I think that that's important for people to understand if they might be interested in working or volunteering for hospice, that the work is not depressing in that sense.
That's good to know.
Yeah, I mean, we had an experience, both my parents, and hospice was new to us. Once your father's sick or your mother's sick, it's the first time you've ever gone through it. And hospice was suggested, and we freaked out as a family. But there's a lot of us. There was 9 of us in the family. So what I found that hospice did, not only taking care of my dad and my mom, is took care of the family. There were times when I had wished during this process I was an only child, because dealing with my sisters and brothers was more challenging than my parents, and hospice was sort of the buffer. They gave us the information that then I could relay, or my sister could relay to the other siblings who were spread out, and it was hugely helpful, helpful. And if I'd known more, we would have started it earlier. And I talk to people all the time about not being afraid of it, how it really helps the patient, but as equally helps the family deal with death, with loss, and just how to manage it so everyone is sort of okay with it. Not comfortable, but okay with it. And it was a life changer. So when my dad got sick first, and then my mom, it was like, we're bringing hospice in right now. And they were, the people that do this are angels. I mean, they really understand, and they've got experience where the rest of us don't. Because when your parents go, it's like the first time and the last time that's going to happen. Because unless you have more than 2 parents, that's it. So you want to do it right. And we were able to, and hospice was a lifesaver for us. And I try to spread that message. Just don't be afraid of it, welcome it, and really make sure that you include the family, because the nurses, the social workers were invaluable, especially with my mom. Because that was tough on my sister. That was tough on all of us, but my sisters. And again, this is. You get into these fights that can be life-altering after your parents go away if you don't handle it right. And hospice was just wonderful. And we're happy to have Old Colony as part of our chamber to serve our population as well.
Well, thank you, Tim, for sharing that very much. And yeah, these are difficult conversations to have, but it's good to know that there are people that can help us. We're not alone, and that's and as you talked about, these are the things that sometimes you know what's going to happen someday, but you don't want to think about it. I didn't want to think about my dad died when he was young, but you got to have these conversations. You're right about that. So think about it. All right. Well, Jennifer Cooperman, social worker, and Betsy Nazar, RN case manager, Old Colony Hospice. OldColonyHospice.com is the website, and if you want more information, reach out and have that conversation and get started. Jennifer and Betsy, thank you for coming in today.
Thank you very much for having us.
And Tim, thank you as always.
I'm
Tim
happy
Cahill,
to be here.
South Shore Chamber of Commerce.
Thank you very much. Look forward to my weekly visits when I'm able to be here, especially with our guests. When our guests come, I feel like I should be here as well.
It's great. It's good to have all of you in here.
Yes,
Thank
nice
you.
to be in
so
studio.
much.
Thanks.
Yeah, thank